So the work is designed and is evidence-based to reduce violent crime.
And a new report by the National Institute for Criminal Justice Reform will help inform that work that the Office of Violence Prevention is already doing, like ATX Peace, a community violence intervention program with a holistic approach.
To provide job training and support, mental health services, de-escalation, conflict mediation, things to help give people the skills that they need so that they don't repeat crime.
Shelley Egger was part of the task force that originally pushed for a more proactive response to violence.
I think that what we know from other cities, as well as what we know about what's happening early here in the development of these programs in Austin, is that community violence intervention programs that follow the cure violence model and treat gun violence like a public health epidemic do work. Those programs have been shown to have a lot more long-term success than our traditional criminal justice strategies, which really do just sort of treat the system as a revolving door without addressing the underlying problems that led to the violence happening in the first place.
Looking at homicides in Austin from 2021 to 2022, with most being gun-related, researchers found that victims and suspects of homicides were primarily males between 18 and 34, and homicides most often occurred as a result of instant disputes between individuals who did not have a prior relationship.
What I would hate to see is sort of the typical reaction of, we've identified this target population and now let's target them in the same way that we always have, which has always been with more law enforcement in those communities where we know gun violence is already most likely to happen and have been most impacted. But that has never really worked, and now we know better and we can do better.
Data also showed that more than 60% of homicide victims and suspects were already known to the criminal justice system, and most victims and suspects with prior criminal offenses had been arrested around 11 times by the time of the homicide.
In an effort to combat that, the interventions that we do are tailored to speak to the needs of repeat offenders. That's why we do this type of data analysis to understand what's happening and then use that information to design our interventions.